BHR 就好似所有外科手術一樣，多少都會有風險。最重要嘅係喺你決定要接受手術之前，一定要清楚知道當中有乜嘢風險。首先，所有手術本身都會有引起併發症嘅風險，例如全身麻醉嘅風險，以及手術後痛楚、出血，甚至感染等其他一般嘅風險。至於涉及關節植入物嘅風險，會係金屬對碰金屬嘅部件，有機會因為關節潤滑不足而失效。
And in order to be lubricated, the cup has to be precisely positioned so that the lubricant fluid, which is the body's own natural lubricant, doesn't escape and allow metal to rub on metal, which causes them to fail.
最後係 BHR 呢類表面翻修手術獨有嘅併發症，就係喺手術後頭3個月，股骨頸有機會出現骨折。
That's this area of bone underneath the resurfacing. So in a conventional hip replacement, we replace that bone with that large piece of metal. In a resurfacing, we just take off the outer layer of bone to profile it so that the resurfacing head will fit over the top. Thus, the problem is the bone can be weakened during the procedure. This one has a tiny little notch in it from the cutting tools, and that can act as a stress riser that allows the bone to break off completely.
The main danger of this type of operation is because they shave the femur that you can have a stress fracture there fairly easily. So the most important thing is to let the bone fully recover before you put any sort of stress on it.
The problem for patients is that after about a month, they feel fine and they don't want to sit at home. They want to get on with their lives. Their hip doesn't hurt. But this could be quietly developing a crack. The crack is painless until it completes, and that's a disaster. So it's very important for patients who want the good long-term function of a resurfacing to be willing to be patient for about 3 months after their operation.
喺進入明德醫院手術室之前，你需要斷水斷食6個鐘頭。手術會喺全身麻醉下進行，你將會喺全個手術過程失去知覺。手術基本上分2個部分，首先將扣杯放置同固定喺盤骨，然後為受損嘅股骨頭進行表面翻修。一旦髖關節外露，醫生就會刨刮髖扣，騰出空位，直入扣杯。
In order to get the acetabular cup in the resurfacing in the right position, we use the standard instruments with the addition of a spirit level and a laser guide. We position the patient very carefully on the table to get the pelvis in the right place. And then we place the cup and, using the spirit level and the laser guide, put it in what we think is the right place. The problem is, despite the positioning devices, the patient's pelvis can move and introduce error. The technique that we use to try and prevent that is to place the cup and then take an X-ray. We can then measure the X-ray during the operation, and if the cup needs to be readjusted, we simply reattach the cup introducer and we can reposition it. If the cup is in the right position, we can cut these wires attaching the cup introducer, and we're left with our accurately positioned cup. We've measured 100 consecutive cups placed in this way with the X-ray and seen that we've managed to put all the cups in the right place. And this is being published so that other surgeons might consider using that technique.
到咗手術嘅第2個部分，醫生會重塑患有關節炎股骨頭嘅輪廓，將金屬股骨頭好似頭盔咁戴上去，再黏合喺適當位置。 喺縫合之前，醫生會喺關節注射藥物，減少手術後嘅出血情況，又會喺傷口深處放入抗生素海綿，減低感染機會。最後，醫生會縫埋髖關節皮膚，等病人喺全身麻醉結束後喺休養房甦醒。